morning. My name is Raju Kakalpudi. I manage the Public Health Informatics and Planning Division at the Health Department. And I'm thrilled to announce, hey, stop it, I'm already tensed. It's been a while since we presented publicly. Every time it's Zoom for the last 5 years. And I'm thrilled to welcome you to the Place Matter 6.0 showcase. Today is a special milestone. We are celebrating our 10th anniversary of this project, a powerful collaboration between Community Health Endowment, Lincoln Lancaster County Health Department, and many other city departments and community partners. Place Matters is far more than a data report. While it's built on sources like vital statistics, public health, surveillance datasets, census data, local data, its true value is in how it tells the stories of our city and inspires meaningful action. Today, local leaders will share projects inspired by these stories, focusing on themes like reducing poverty, boosting youth fitness, improving access to health insurance. This work is only possible thanks to dedication of many people. We want to give a special thank you to Ruma Khan, Lata Nawal, Deb Byrne with the Lincoln Lancaster County Health Department, Kurt Elder with Urban Development, Emily Gratup with UNL SNAP Education, Emily Kluwer and Morgan Hermanic with Community Health Endowment, along with their Board of Trustees, Kaylee Braswell with Lancaster County Medical Society, and Matt Avey with Lincoln Public Schools. As you listen today, I encourage you to critically know about how you can use this information to help Lincoln stronger and healthier for all. Now I'll invite Kate Bowles, President CEO of Community Health Endowment, to present Place Matters 6.0. Thank you.
Good morning. Good morning. How's everybody feeling today? Benny's feeling good. People, are we feeling good about our Husker win? Feeling good about it being the Friday before a long weekend? Yeah. So that's what the Community Health Endowment is all about. It's not a glib question for us at all. That's central to our mission of making Lincoln the healthiest community in the nation. So I'm so glad you're here with us, and I'm glad you're feeling good. But Place Matters reminds us that the answer to the question, how are you feeling today, is multi-layered. It's complicated, and it depends on a wide variety of factors. Were you fortunate enough to get a healthy breakfast this morning? Have you been able to get some physical activity this week? Are you one of the lucky people who has a health insurance in your purse, health insurance card in your purse or wallet? All of these questions are central to what it means to be a healthy resident of Lincoln. And unfortunately, not every resident can answer yes to those three questions and others. So Place Matters helps us to understand some of the challenges that our friends and neighbors face to living healthy lives, and helps to inspire solutions to those challenges so everyone can feel as good as you do this morning. It's important to me, as we present the Place Matters data, that we're not just thinking about data points or places on a map, but we're connecting those things to real people and real lives. I want to highlight a project called the Strengthening Prenatal Care Project, run by our friends at the Asian Community and Cultural Center. At a recent site visit, they shared a story about a young Sudanese woman, a recent American, who was struggling to navigate the healthcare system. Not only that, she wasn't feeling well. And in part, that was because Sheila and her team were able to help her understand her proclivity for gestational diabetes and get the care she needed to make sure that she was healthy and her baby was born healthy. And that's really one of the best and highest uses of the Place Matters data, for us all to focus on those folks with the greatest need and the greatest potential for an intervention to make a huge difference in their lives. I'm really pleased to report that we've made progress in our prenatal care data. The Lincoln Lancaster, and yes, thanks to many people in this room. The Lincoln Lancaster County goal is that 80% or more of women will have adequate access to early and adequate prenatal care. We have achieved that goal in 12 census tracts, and in no census tract anymore are more than 50% of women not accessing prenatal care. We have a lot to be proud of with this map. We also have a bright spot in our healthy food access map. And while you'll hear soon from Michaela Kumpke at the Food Bank of Lincoln about the many challenges they face in making sure that our friends and neighbors have access to fresh, healthy foods, I think it's helpful to point out that our healthy food access map shows that there is access in areas of the city where there is also significant concentrations of poverty. The core of the city is often a challenging place from a data perspective, where we see intense poverty and social vulnerability. And yet, it's a place where there is some access to healthy food. Certainly, room for progress here, though, as well. Our next map is a map that we actually brought back into the Place Matters data set. It's our lack of health insurance coverage map. And we brought this back because even though we have made great progress as a city and as a nation in ensuring people have access to health insurance coverage, including Medicaid, Medicare, and private insurance, I think some people will be surprised to know that in 22 census tracts in our community, more than 1 in 10 people do not have access to health insurance. That might be individuals who are 26, turning 27, rolling off their parents' health insurance. It might be individuals whose income doesn't allow them to make this purchase. It might be folks who don't qualify for Medicaid or Medicare. But we still have challenges to overcome in terms of people getting the health care they need through a health insurance product. And while we have wonderful physicians and a number of fantastic primary medical care providers in our community, it's important to note that the yellow census tracts in the center of our city represent an area where we are medically underserved. And that, of course, correlates again with some of the most intense areas of poverty in our community. So we have some work to do in terms of primary care providers. I will say, though, there are many people and many faces in this room that I know are working on those issues and think every day about making sure that people can walk in the door to get the health care they need when they need it. The next story I want to share with you is about one of my favorite nonprofit organizations. It's the Hub Central Access Point for adults, for young adults. I was at a recent site visit with the Hub, and they shared a story that they've given me permission to share with you. They were working with a young man who was facing a really difficult time in his life. Using the Place Matters vernacular, I would say he had many social vulnerabilities, including a low socioeconomic status, lack of transportation, and other challenges. He came in the door of the Hub in a dark place in his life. They administered something called the Hope Score, and his Hope Score was unsurprisingly low. But after working with the Hub, I'm proud to say he's now enrolled in a program to become an LPN. And at his most recent visit to the Hub, he came rushing into the executive director's office, holding his Hope Score high, saying, "Look how much I've improved." And I think that story is so lovely, not just because his life changed, but because it demonstrates something important about our data. The Social Vulnerability Index, which we'll talk a little bit more about in a moment, describes multiple factors of multiple life challenges. It can feel overwhelming. What's so inspiring about the Hub is that not only have they found a way to measure how to improve someone's experiences with their social vulnerability, they've proven that it can get better. And I love that. So this is our Social Vulnerability Index. For those who are unfamiliar, it's a tool created by the CDC, by the Centers for Disease Control, and it indexes 16 different factors that might make someone more socially vulnerable. Things like not being able to have English language proficiency, things like not having access to a vehicle, things like being of low socioeconomic status. And when you measure all of those things together, put them all together, you can see that we have some things to be concerned about in our community. Not only do we have a number of areas with that dark purple intensity of individuals facing social vulnerabilities, we also know that those census tracts have spread since our last Place Matters report. So it's important to note that there's no one indicator that tells you whether or not someone is struggling to live a healthy life. Just like you, just like me, there are multiple factors that make us feel good or not so good on any given day. And as a community, when we put all the factors together, we've got some challenges ahead. It's important to also note that we have a significant number of census tracts where there's an intense amount of people living in poverty. This is maybe more concentrated than the Social Vulnerability Index, but in the core of the city, we still have a significant amount of poverty. And right here, where Centerpoint is, I think the folks who work here could tell you that there are people in this neighborhood with great need. I do want to share that one bright spot in our 10th anniversary edition of Place Matters is that from 2014 to our current report, to our Place Matters 6.0 report, we've actually seen improvement in our overall experience of poverty in Lincoln. When we first produced our Place Matters report, this indicator was at 14%, and today it's at 11.2%. And when you roll that up over lots of people, over lots of time, that is progress. Yeah, you can applaud for that. That's great. You'll hear more from Tom Randa in a few moments about the poverty and minority population, but I do want to highlight this map, which demonstrates individuals who are above average in poverty, have an above average minority population, and there are 21 census tracts where we have both an above average poverty rate and above average minority rate. So that intersection is important for us to pay attention to and to respond to in a culturally competent manner. The older adults map is one that is kind of close to my heart. I think our senior citizens deserve our attention. And what is important to note in this map is that the concentration of individuals who are senior citizens is not the same as the concentration of social vulnerability. In spite of the fact that individuals who are aging, especially those over 75, may have challenges with social connection or transportation, but the areas of the city where they are concentrated is different than those who have a social vulnerability challenge. So we can't leave our seniors behind when we think about transportation planning or food distribution or access to community activities. I want to share one more quick example, one more quick story. I was fortunate enough a few weeks ago to get to go to one of the basketball games for the Get in the Game program from the Community Learning Centers of Lincoln. If you're unfamiliar with the Community Learning Centers, they provide after-school activities, particularly in Title I schools, in lower income schools. And recently, with the support of the Community Health Endowment, they started something called the Get in the Game program, which gave kids who were participating in those after-school activities the chance to really participate in a sports league. And I was able to attend one of the basketball games. And it was very charming. It was all, elbows and knees and awkward kids. But the exuberance and the pride on their faces was really special. And I happened to know that one of the young women playing in the game was both daughter of a single-parent household and someone who was fortunate enough to participate in another CHE program, teammates. The point of sharing that story is not just that we need to respond to the youth fitness indicators in Place Matters, but that our best and highest interventions as a community bring together multiple data points, bring together that social support, that physical activity, and that connection to community. I'm pleased to report and thankful to the partnership of Lincoln Public Schools that we've made great progress in youth fitness. We identified this as a challenge, particularly post-COVID, when we saw some of the youth fitness indicators really decline. Some of you may remember, others of you may not, but there's something called a PACER test, which is a running test that the Lincoln Public Schools kids do. And we saw a deep decline in the passage rates for those tests. I'm happy to report that the overall passage rate has improved, not dramatically, but quite a bit. And in 5 census tracts, we've moved significantly above that 50% passage rate. So kudos to the Lincoln Public Schools and all the other folks who have taken the challenge of youth fitness and ran with it. And I hope you appreciate what I just did there. Another new map in Place Matters 6.0 is a map about the population with a serious disability. The US Census Bureau does track a number of questions related to a serious disability, a significant challenge to living a healthy life, such as a mobility challenge, a chronic mental disability, a seeing or hearing disability. These are self-reported, but you can see on the map that there's a number of census tracts all across our city where there's a concentration of people with disabilities. And I think this is a map I hope elicits new and more discussion about inclusion, about what it means to make sure everyone in our community, in spite of our challenges, gets a chance to live a happy, healthy life. The last map I want to share with you this morning is our life expectancy map. This is a map we've had since the beginning, since our very first edition. And I'm pleased to report that in the census tract with the lowest life expectancy, noted here at 69 years, that has increased significantly since our first map over the last 10 years, where it was closer to 63 years. And I want to pause on this map for just a minute. First, because I think that difference, that's significant. Think about 5 years with your mom. Think about 5 years with your best friend or your spouse. How many memories, how many meals, and how many moments of laughter. That makes a huge difference in people's lives. Not only that, but when we look at why we do all of this, why the Community Health Endowment focuses on health, why you show up to listen to a data report on a Friday morning, why the wonderful people in the room who provide health and human services stay inspired to do that every day, this is what it's all about. It's not just more years in our life, it's more life in our years. And I'm so grateful for the partnership of every single one of you for helping CHE achieve our mission of making Lincoln the healthiest community in the nation. So with that, I'm going to turn the microphone over. Before I do that, special thanks to Lincoln Lancaster County Health Department, Lancaster County Medical Society, Lincoln Public Schools, Partnership for Healthy Lincoln, City of Lincoln Urban Development Department, and Nebraska Extension. All of these folks helped a brand new president and CEO put together a very complicated data report, and I would very much appreciate it if you would give them a round of applause. Okay, and with that, I'm going to turn the microphone over to one of the inspiring leaders in our community, Michaela Kumke with the Food Bank of Lincoln, who's going to tell you a little bit about the Lincoln Fresh Food Program.
I am glad that Kate ended on the slide that she did, because 10 years ago when I started at the food bank and when Place Matters launched, I remember seeing that slide, and it was shocking for so many of us, the age discrepancy between neighborhoods in our community. And so just a quick note of thanks to Community Health Endowment and the university and city and county for taking on this entire project, because we know things about our community, but with the data, we could prove things about our community. And so it's mighty helpful to have. Food Bank of Lincoln was fortunate to be one of the legacy projects of Community Health Endowment and in launching Lincoln Fresh, which I think is a pretty popular program. And it probably is more popular than if we had called it Honk Honk, Here Comes Healthy Food, like we had talked about. Sorry, Scott, I think we landed right on this one. But it was sure a lot of fun in thinking what we might call it. Real quickly, what we know about food insecurity in our county and across southeast Nebraska is that 1 in 7 of our neighbors, including 1 in 5 kiddos, face hunger and food insecurity. And access to healthy food is a major part of that. So what about Lincoln Fresh? What is the program? It is a food distribution that focuses exclusively on getting fresh fruits and vegetables out to areas of our community where folks don't have easy access. And our locations were based on the Place Matters mapping project. As you can see, it's a seasonal program. So we're 4 months left of reporting, about 3 months left of activity for this season. But it was wildly popular from the moment that we launched it and grew in its familiarity. And all of that has to do with the partnerships that the food bank has in this community and the accessibility and the sense of welcome. As you can see, all are welcome to these distributions, and we take that very seriously. There are no barriers to access for fresh fruits and vegetables, and we think that that is incredibly important for a number of reasons. One of those reasons is that produce can be, 1, extremely expensive, and 2, may not always be familiar to folks. And so something like Lincoln Fresh is a high impact, low, low risk, high exposure opportunity for us. So I think about the first season of Lincoln Fresh where a little girl who is not originally from Lincoln, Nebraska, saw mangoes in our basket and was thrilled. She was thrilled to see something that she recognized. And then there was also broccoli. Who would have thought that a kid would get excited about broccoli? But it happened. And being able to get those kinds of foods into our neighbors' hands and maybe letting kids especially with their parents or caregivers sample these items and get excited about it, to have folks around talking about these foods. And this is a not so highlight. Some of the changes that we're facing currently would be the SNAP Ed. The cut of that program has an impact because SNAP Ed has been an incredible partner from the beginning to be at Lincoln Fresh and to provide samples and recipes and create open doors to access. It's a downright shame when those things get cut because it has ripple effects. And we could dwell on that. We won't. We'll find new ways to continue to make those things possible. But I do want to take a moment to thank the SNAP educators for their commitment because they were all in and really got to know community and kids and create that whole environment in partnership with us. But that's one of those big things. When we talk about the stops, this is the list of locations. This season, we make 15 different stops every other week. And you can see, we are all across this community, and it is very much on purpose. Again, came down to the Place Matters mapping project, and that told us where to be, and working with those partners allowed us to be there. Fresh fruits and vegetables are very expensive, and it has been challenging to afford them. We definitely eat healthier because of the Lincoln Fresh program. That pretty much sums it up. And here's what I love about this program, and something that I want to share with all of you and make sure that as budgets change, as financial constraints increase, the variety of foods that we've been able to offer have been tremendous, and I don't want that to stop. It's so important that we offer seasonally fresh food, that we offer culturally familiar and affirming foods to our neighbors, that we give that opportunity to sample and spit out. If you don't like it, it's okay, because you might like something else. And also to have that welcoming environment. We have seen numbers change where maybe some of our neighbors who access these programs don't need as much as they used to, or they're seeing the change in the menu that we're able to provide, so they don't come as frequently because some things are on repeat. But we very intentionally create that environment where anybody can come and access these foods, because we feel that is also strength of community. And that's what makes us all healthier, to be among neighbors who look different than ourselves and speak different languages than ourselves and have ideas that might be different than our own. That is community, and that is community health. So real quickly, you can see the rundown. You might instantly understand that 2020, we had to change some things with this program. We got all very excited to get it launched. The world went upside down, that changed, but then it came back with full steam. And as I mentioned, we still have 4 months of reporting left for 2025, but 1.3 million pounds of produce in this community is incredible. On average, each neighbor gets about 8.5 pounds of produce per visit, and it's about 1,000 pounds of fresh produce per stop. So again, you can see how the numbers have changed, the interest has grown, and like I said, we're not finished with this program for the season yet, so we'll see a good bump up there. And this is the last note. I just think it's always important to hear from our neighbors and to understand. We can talk, but ultimately, it's making sure that every neighbor has access to healthy food. So thank you, Community Health Endowment, for being such a catalyst for this, and to folks who continue to support the food bank's work so that we can get this produce out there. And one of those folks is Tom Rando, who will speak later. But Maya, I guess you're up next.
My name is Maya Cartwright, and I'm here with Libby Valeria Boster, and we are from Brave Bee Child Advocacy Center. And Libby and I are part of our Brave Faces Prevention Initiative. That is a CHE legacy project, so that's what we wanted to come and talk to you a little bit about today. We've been utilizing the research of adverse childhood experiences and also the research behind the Social Vulnerability Index on really bringing about awareness, education, and even action into adverse childhood experiences. And we were asked to show you this, so we'll do a little demonstration as we're talking. For this backpack that Libby's carrying really represents, because we're all heading back to school, really represents what our children are facing right now and what they're carrying on their backs. This is different behaviors, emotions, and experiences that they have. And for some kiddos in our communities, this is heavier. And it's heavier because of those adverse childhood experiences, or ACEs, I'll be calling them. While there are several different ones identified in research, I want to just identify a few different ones today. So these are things like abuse and neglect, which are probably the most common ones that people know about. But it's also things like having a parent who is struggling with substance misuse or mental health issues. It can be things like homelessness. It can be things like poverty and those lack of resources. It's also the death of a loved one, especially a caregiver in the home. And when we put all these things together, this backpack gets really, really heavy. So one of these rocks, I'm sorry you have to carry it. One of these rocks by themselves, it can be heavy, but it's manageable. When we put these together and we compound that toxic stress, it gets very, very heavy. So when kids in our community are carrying heavy backpacks like this, carrying that burden, it can be difficult to pay attention in school. It can be difficult to behave, to sit still, to even make friends and things like that. And what I also want to point out is that this backpack doesn't just lose its rocks immediately when these children become adults. This weight stays with them for a really, really long time. And that's what the research and the science behind ACEs tells us, is that adults who have had ACEs as children are at much higher risks of a lot of different health risks. So things like depression, things like heart issues, diabetes, cancer, all of these are increased if a child has had several different ACEs. But there is hope, and you'll see a lot of common themes from here, from different agencies doing the work. So I want to show you a little bit about what those positive childhood experiences are and protective factors. So one of those things is, like Michaela just talked about, is having healthy food options, something that's quick and easy so that kids can be healthier. Another thing is having an adult who takes a genuine interest in a child's life, so like a mentor, maybe a mentor helping kids with schoolwork. Another one is safe spaces, especially safe spaces outdoors where kids can be active, they can use their physical abilities, and stay healthier. And then another one is social connections and a sense of belonging. We all want to be part of our culture, our community, so really having that sense of belonging and knowing that you're not alone is so important. So while Libby was putting these in the backpack and taking out some rocks, there's still some rocks in there. We're not going to always be able to take all of them out, but we can make that load a little bit lighter for those kiddos. And those kids who turn into adults have more of a chance to flourish later on in life. So going back to what we're doing at Brave Faces is we are really looking at this social vulnerability index and identifying those communities that need the most help. And some of those communities really suffer in the services that are provided to them. So we're bringing that education, that training to those neighborhoods. And we're also bringing our Building Resilient Families course to those families. So we've partnered with places like the Belmont Community Center and just recently Las Abejitas Daycare, which is at First Plymouth Church, really partnering with them to teach parents about their own resilience and about what they can do with protective factors within their own home to really help them get a head start, especially early on in life, so that maybe some of our maps aren't as colorful later on in life too. There is a lot more information about ACEs and PACEs that I do not have time to go over right now. So please visit us at the map after this, and we'd be happy to share a lot more. Thank you.
Good morning, everybody. My name is Tom Miranda. I am the Executive Director of the Good Neighbor Community Center, and I'm also the Chair for the Culture Centers of Lincoln. And I want to also introduce Sheila. She's with us as well today. She plays various roles. She's the treasurer, she's the secretary, whatever we want her to be for the Culture Centers of Lincoln. So glad you could be here as well. Today I'll be highlighting the data that has been shared already here, and one of really wonderful project that we've been working on since 2019 with the Culture Centers of Lincoln. So I'll apologize for those who at Cause Collective on Tuesday. You've already seen this, but you're welcome to share with your friends around you what this is all about. The Culture Center started in 1999 as the Culture Centers Coalition. And we've been meeting together ever since. And these are the 6 organizations that are part of the Culture Centers of Lincoln. So when we started the collaborative project is when we realized there are some things we need to change about our 501(c)(3) status. But during COVID, you know how hard it was to change things. So we decided it's a little bit easier to change the names from Centers Coalition to Centers of Lincoln. So that's why there's a name change in case you're wondering. Wonderful people we've worked on with this project, and our mission is to promote the cultural empowerment through collaboration, education, and advocacy. So in 2019, Community Health Endowment invited the directors for the Culture Centers of Lincoln. It was a reflection of, I believe it was the 20th year for the CHE. And when we sat as directors, we came up with a lot of issues that were happening in our community and at our centers. And I'm so grateful for CHE because they invited us a few months later to just come and sit down and have strategic meetings to see how we can solve these issues. And one of the biggest one is looking at the data. Since 1990, we see that the percentage of people who identified as a minority in our community was 13%. And the projection is that by 2050, that number will go up to 35%. And when we started this project, we were looking at one of the Place Matters maps back then. So you will realize that when we were looking at it, it was 18.4%. And when I updated this for my previous meetings, it was 20%. But I believe now if you look at your page today, in the middle section, it has the most updated number. So take a look at that, and we'll talk some more about it after we're done with this presentation. We'll be over there, Sheila and I, and Lisa can talk to you about this. So that number, this is one of the data that we've been looking at during our meetings, and one of the needs that is happening in our community, that we have a huge population of minorities. And when you map that on the map, you'll see that the concentration is in the middle of our city. And then we look at the number of poverty. Like we said again, we started in 2019. We are looking at that number. I was really happy to see that it's going down. So looks like a lot of folks of you who are in here have been doing a great job. So I was very excited to see these numbers going down. And then we ended up combining those maps. And it's really laid nicely in there in your books that you'll be able to see it very well. Right in the middle, when you combine them, you'll see this is the area where there's a correlation between those two census tracts where the minority population is above 20% in our community and the poverty level above 13%. So that's the need in our community. So we ended up placing our cultural centers in those areas. You can see where we are. We are the 6 cultural centers, and you'll see that Ponca Tribe has a new facility south, but they also have one on 17th Street, and then the rest are really located in those areas where the community need is really high. After looking at those needs in our community, we looked into our cultural centers themselves. And we identified that there's a growing need because of all the numbers that you've seen in our community. That means some of our buildings that were built in the 50s and the 60s are still the same, but the numbers keep increasing. So what can we do about this? There's no space. And when we sat and did these meetings, it was more like, we can't keep putting Band-Aids. We need to find a better solution to this. And this is when we came up with the Lincoln Cultural Centers of Lincoln Collaborative Project, which is going to construct a new Cultural Centers of Lincoln building. And we are going to renovate the buildings for those who own buildings. There's going to be renovations for those. And there'll be a new place for our centers who do not have their facilities to call a home. And for the core agencies that the Asian Center, Good Neighbor Community Center, Malone, and El Centro will have they're the core agencies that are going to be in this building. And it's also really important for us to maintain our identity. So when you're talking about a cultural center, you're not just saying it's all cultures, but it's more like these different cultural centers that were in different places. They're coming, sharing resources, but you'll still be able to say, I'm going to the Good Neighbor Center, I'm going to Asian Community and Culture Center, I'm going to El Centro, or I'm going to Indian Center, which is also a part of that. So you'll see we've mapped where the building will be, and there's a renovation. Happening. The Indian Center, the Good Neighbor Center. We've talked about the new facility for Ponca Tribe of Nebraska, and we're also talking about El Centro and the Asian Center having a new place to call home. So all their services will be in there. And we are actually going to be moving the food distribution program thanks to one of our biggest partners here, Food Bank of Lincoln. And we're going to focus more on healthy food distribution for our community. And the Malone Early Childhood Center will also be moving there. And as you're also aware, they also have a campaign, and they're also rebuilding. They're not renovating, GNCC renovating, but Malone is rebuilding. So where is this going to be at? So you've seen on the map where it's at, but this is the current location. So this is how the partnership is working. UNL has that space, and they ask for a developer to come and develop something there that is going to benefit the community. WRK put a proposal where the Culture Centers project was one of the projects. So we are going to be occupying that corner of the property, and there'll be other things that will also be coming here that I can't talk about because they're still working on those, but I believe it's also very good projects. But the Culture Centers of Lincoln building is going to be located at that corner. And that comes at a price, and we are talking about $24 million. And with that said, one of our campaign chairs is here today, Michelle Suarez, and your husband is here as well. So we are very grateful to have her. And Connie Duncan is also one of the other co-chairs. But before that, Connie was our project developer. So we had this vision, and we said, Connie, make it happen. So she's been able to do a lot of work for us. And then when the feasibility study was done, everybody said this can only happen if she's one of the campaign chairs. So she came from working for the cultural centers. Now she's volunteering as a campaign chair with Michelle. And Kate is also here, one of our members for that one. Don't know who else is here. They're not here this morning, but very grateful to members of our campaign, Capital Campaign Committee. So that being said, you'll just see how it's been looking. We started this project in 2019, lots of planning, looking at the data, and then eventually we are at about where we're about to start construction. So we are talking about October 1st as a groundbreaking event, and we are hoping that you can all join us. We're very excited about that. So as we move forward, you're thinking about what is going to happen after the construction. We want to maintain this building. So these are some of the things we're also doing as part of the meetings that we had been holding, how we're going to sustain this building. We are looking at affordable housing, and with the profits coming from that, they should be able to sustain the building. We are looking at a $1 million endowment, which is part of the campaign, the $24 million. And we also have two projects that now will be happening. One is the Foxtail Meadows, where we'll be building 6 refugee homes, pay off that debt, support the community, and then from the proceedings, that can also help support this building. And we'll also have rentable space. So if you think you need some space for an office, that will be coming up. Speak to one of us, and we'll be happy to talk to you more about that. So I'll let this play in the background. My time is up, but there's a video here showing the renderings. We have more of there on the side. Come talk to us. And we want to thank Community Health Endowment for giving us that platform to talk about this project and be able to be one of the supporters. Thank you so much.